March is Colorectal Cancer Awareness Month. We discuss the importance of early screening with the medical director of the AtlantiCare Cancer Care Institute and why this is so especially important for Latinos. It's all here on the next Latino Motion. Join us.
Choose to get lost in the woods to gain experience in forest management.
Choose to travel through time to understand the past.
Choose to soar to pursue a career in dance.
Stockton University offers 50 high-quality academic programs, small class sizes, and affordable tuition. Choose to match your interests and talents at one of New Jersey's nationally ranked universities.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation, and Stockton University. This edition of Latino Motion with Bert Lopez is brought to you by the HD Studios at the campus of Stockton University.
Funding for Latino Motion is provided by AtlantiCare, offering primary, specialty, and urgent care, plus surgery and more. Atlantic City Electric, energy for a changing world. And South Jersey Gas.
Welcome to Latino Motion, a weekly interview show highlighting issues impacting New Jersey's Latino community while advancing understanding of Latino cultural heritage and contributions to our society. And here is your host, Bert Lopez.
Buenos dias and welcome to Latino Motion. March is Colorectal Cancer Awareness Month, and my guest today is Dr. James Weiser. He is the medical director of AtlantiCare Cancer Institute. And Doctor, welcome to Latino Motion. It's a pleasure to have you on the show.
Thank you so much for having me.
I know that you're not only the director of the Cancer Center, but you're also the AtlantiCare Radiology and Oncology Director. We want to talk, this is not a very sexy subject to talk about when we're talking about colon cancer, but it is a health concern for many. Tell me, what is colon cancer?
Right. So it is a very, very important issue, and I'm so glad that you're broadcasting this. So colorectal cancer is a cancer that starts somewhere in the bowel, either the large bowel, the colon, or the lower part, the rectum.
Now, tell me a little bit about what symptoms someone could experience who happens to have this type of cancer.
Well, many times patients have no symptoms. And because of preventative medicine, we're oftentimes able to screen patients and identify a problem before it becomes cancer or early in its stage. However, there are some symptoms that are associated with colon and rectal cancer. And they usually arise from bowel complaints, changes in someone's bowel habits, whether it be constipation, diarrhea, rectal bleeding, bloating. But sometimes it's something a little more subtle, like they're losing weight, they're fatigued. So it could be a whole host of symptoms, and at the same time, they may have no symptoms.
Now, obviously, cancer, colon cancer, like any other cancer, does not discriminate, right? But there are certain risk factors associated with cancer, and particularly colon cancer. Can you tell me about what are some of those risk factors? Who is at risk?
Sure. So there are some risk factors that patients could do something about, and then there's some things that you just simply cannot help. The things that you can't help would be a genetic predisposition. Some people have it in their family. Some people carry genetic defects, and there are many types of genetic defects that are highly associated with colorectal carcinoma. Those patients, once identified, are screened very, very carefully because they have such a high incidence of developing colorectal cancer. But there's a lot of things that a patient could do to avoid colorectal carcinoma. And those would be to eat a very healthy diet, a diet that's high in fruits and vegetables, lower in saturated fats. We also know that colorectal carcinoma can be associated with individuals who smoke, who drink, or who have diabetes. So if you have a strong family history, if if you have a relative who has had colon cancer or rectal cancer, you're someone who should definitely be screened, and you would likely be screened more carefully because you're at higher risk. But if you have any of those other high-risk features, we would obviously want you to try to mitigate those risks. We want you to decrease the risk of developing it by getting a healthier diet and exercising, limiting the alcohol content, and really working on diabetes. And there's a lot of things that can be done to help lower your blood sugar.
Essentially, diabetes, if you're disposed to diabetes, there's a good chance that you're at risk. Tell me about the age group. Typically, what age group would you associate with someone that's more at risk in terms of getting cancer, this type of cancer?
Well, it's very interesting. We used to say you should start screening at age 50. That was sort of the general consensus. But recent trends have shown that the biggest growth rate is in patients age 45 to 50. So that group, that younger group, we are now seeing a very large increase in colorectal cancers that we didn't see before. So now the American Cancer Society and other societies have adopted age 45. We really should be addressing this. So, and again, we go back to, especially if you have these risk factors, an aunt, a mother had colon cancer, you have some of these other, health conditions that might predispose you to it, you really need to get checked out.
Is there any contributing factor that's been identified as to why that age group is creeping up to a younger age?
We really don't know. One of the thoughts is diet, but we simply don't know why it is shifting in this way. And it's quite alarming, actually, because we're now, worried about these younger individuals who may not even be thinking about getting screened. And they may not have much in the way of risk factors. And so these patients are out there, and we want to make sure that we are able to screen them and rule out that this is colorectal cancer.
Let's shift gears a little bit in terms of the Hispanic community, and particularly we know that there is a little bit of a higher percentage of Latinos who happen to get cancer, particularly this cancer. The number that I got from the National Colon Cancer Roundtable is that 11% of cancer deaths among males is related to colon cancer and 8% for women. What do you attribute some of that disparity in terms of Hispanics getting colon cancer and having worse outcomes, if you will?
Well, this is really a hot topic. The American Cancer Society specifically is trying to address the disparities, not only in cancer in general, but colorectal cancer in the Latino population. There is really something going on here. Now, we can look at it in a variety of different ways. We can look at the screening and prevention aspects, and we can look at the treatment and survival aspects. So if we look at screening and prevention, we know for a fact, there's a study that was recently published that showed that Latinos are screened differently in certain communities than our non-Latino white patients. They may not be getting the endoscopies. And we'll get into that, what that is, but there is a screening tool, a colonoscopy, and they're not getting the colonoscopies at the same rate as the general population. Now, why is that? We could look at a variety of reasons. Are there racial biases? I don't know. Are there, language barriers? Possibly. We want to know, are they being recommended the same thing as the general population? We want to know, is there a reluctance for some individuals to get screening? And so we need to tease apart all of those aspects. And these are deep dives where we really have to look at what exactly is the root cause of this problem. And then we look at the other side, which is the treatment and survival. So Are those individuals being treated the same way, right? Are they getting access to the best care? And then are there differences in how they have an outcome? So there can be.
You certainly cover a lot of the real underlying issues in terms of why the Latino population succumbs to a higher rate of cancer, colon cancer. We want to continue this discussion. We're going to just take a quick break. We'll be right back with more Latino Motion.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on YouTube, Facebook, and Twitter. We encourage your comments and contributions for show topics.
Welcome back to Latino Motion. We continue our discussion with Dr. James Worser. He is the medical director for the AtlantiCare Cancer Care Center or Cancer Care Institute. Doctor, we were talking about the issue around colorectal cancer, particularly the disparity within the Latino community. And you alluded to quite a number of obstacles. You mentioned two that are very important. One was that Latinos are seeing their physician perhaps less frequently. And there's a reluctance in terms of getting the appropriate screening that's required to detect colon cancer. So I want to talk a little bit about what can be done to prevent colorectal cancer. And certainly those two items that I mentioned that are an obstacle are certainly contributing factors.
Yes, certainly. I mean, I think that we, as the health community, need to work on advocacy, educating folks as to, what are the best approaches to decrease not only colorectal cancer, but diseases in general. And we need to have mechanisms in place so that we are following individuals closely and that we're better able to communicate with individuals. If there are language barriers or there are cultural barriers, we need to understand those barriers so that we're better able to serve our community. So I think that that's one issue in terms of, how do we address those two issues of, having people come in to be screened and feeling comfortable being screened. They need to have a good relationship with their provider, someone who communicates well with them and respects their culture.
Yeah, that's certainly very, very important, critical. So what can be done to prevent cancer, colorectal cancer? And I think you alluded to a lot of it, but what specifically are the keys?
So, if you have a genetic predisposition, you're over age 45, you can't help that. You can't help your age, you can't help your genetics, but there's a lot of lifestyle changes that could take place to help decrease the incidence of colorectal cancer. So as we discussed, we look at the risks and how do we decrease those risks? So one of them is a really healthy lifestyle. And this would not just help colorectal cancer, it would help cancers in general, cardiovascular disease, neurodegenerative problems, and that is, obesity. We need to decrease the incidence of obesity in our population. We need to have a diet that is richer in fruits and vegetables, less in saturated fats, red meats, grilled foods. We talked about alcohol, decreasing alcohol consumption. We talked about diabetes. Now, of course, being diagnosed with diabetes, you may not be able to, cure the diabetes, but we can better control blood sugars. So that's of utmost importance. Smoking, that is, the bane of my existence because smoking is related to so many different cancers. If you could do something that would really impact your health, it would be to stop smoking. So those are some of the lifestyle changes. And then finally, we get to screening, right? So what is screening? Well, screening is our ability to hopefully detect the problem before it becomes cancer, okay? And if it is cancer, to detect it early in its progress.
So it's important to note that if you're diagnosed early enough with cancer, colon cancer in this instance, that you have a better chance of survival, which is very important. So early detection is really critical.
Yeah, I mean, absolutely. Early detection is the key. You don't want to see me. You don't want to have to come to the cancer center. It would be nice if we were able to either diagnose it before it was cancer, and that can be done with some of the screening tools that we have. We may be able to detect the problem long before it's actually cancer. Secondly, as you just stated, and this is of utmost importance, the earlier you diagnose the problem, the better the cure rate, the less treatment the individual may have to undergo. And so you're really doing yourself the big favor. I know many people don't want to get screened. We all live in denial sometimes, and we're busy, and we find it a chore to go and get these regular health checkups, but they're designed with a real purpose in mind. We want to decrease the suffering of individuals diagnosed with cancer. And so this is the biggest tool. More important than all of the treatments that we have, if we could prevent it or diagnose it very early in its course, that would be so wonderful.
And doctor, I know that there's a reluctance to get screening, and that's a common theme apparently within the Latino community. Walk me through the process of screening, and is it painful? Is it intrusive? Tell me a little bit about the details.
So there's a whole gamut of ways that we can screen an individual. Probably the easiest and the least invasive is a stool test. So we can test your stool to see if there's blood in it. We can test your stool to see if you have any genetic abnormalities, okay? So that's completely non-invasive. There's a test called Cologuard, some people may have heard of. And so this is really like a non-invasive approach. We also have some other really interesting ways that we can screen individuals. So obviously everyone's probably familiar with the colonoscopy, right? This is the invasive procedure. This is the procedure, but it's also the gold standard. Okay, this is really the best way to screen an individual. And yes, you have to undergo a bowel prep where you drink fluids and try to clean yourself out. And then they proceed with the scope, which goes up. It looks at the rectum, the colon, and it's the gold standard. And that's really recommended to most people. But we have some other unique ways to test individuals. There's a virtual colonoscopy, which is basically a particular type of CAT scan that can be done. So there are some non-invasive, interesting techniques. I'll always go back to the colonoscopy is the gold standard, but there's some other things that we can do which could give us, important information. Maybe it's not the gold standard, but there are other tests that can be done. And I wanted to lay them all out for your audience so that they're aware. They may have heard of these other ways of testing. Yes, they're not as sensitive, they're not as specific, but they are true tests that we use on individuals.
And doctor, I did have the colonoscopy done myself. Went through the prep and it was painless. Certainly something that gave me peace of mind, and I'm sure that those individuals that are reluctant should know that this is not such a great imposition. It's really about getting some peace of mind that you're safe, that you don't have symptoms that could lead to shortening your life, really. So it's important that we follow and get those checkups.
Absolutely. That was a great point, is that it's not painful. It's not a situation where you're going to be truly uncomfortable. And it gives us such vital information. But for those of you who are out there who are scared to have a colonoscopy, if you've been recommended it, I want you to know that this is really a test that should not generate pain. You should be comfortable, and it will give you great peace of mind knowing that you've been screened. and that, it's something good that you can do for yourself.
Many of us want to take care of ourselves, right? To go through the, make sure we're taking our vitamins, that we're trying to eat healthy. Let's take it to the next step and do the screening if necessary. Doctor, we want to continue this discussion. We've got a lot more to talk about. We're going to take a quick break. We'll be right back with more Latino Motion. Welcome back to Latino Motion. We continue our discussion with Dr. James Worser. He is the medical director for the AtlantiCare Cancer Care Institute. Doctor, we were just having a great discussion in terms of preventive measures and certainly screening. Screening is the key. Early detection is the key. Just want to emphasize, is it possible to have colon cancer and not have any symptoms at all?
Yes, it is. And that's the real use of the screening tools that we have, the colonoscopy particularly. I can't tell you how many times we've had patients who have been feeling completely normal, asymptomatic, no symptoms at all, and they go in for their routine screening. And they find out, wow, I was diagnosed with a precancerous lesion, or I was diagnosed with an early stage cancer that's very treatable. So yes, it is. It's quite common that patients will be asymptomatic and be diagnosed. And so that goes back to why we really are stressing today, why it is so important to have that routine screening, to see your personal physician and talk to them. They can go over the guidelines with you and make recommendations for you. And that's the first start, is to talk to your primary care doctor, the person that you trust, that you have faith in and have had a relationship with, and they can make that recommendation at the appropriate time for you to have that screening. Because, if you avoid it, you're only going to make matters worse if there is a problem.
And doctor, I know that with the COVID pandemic, a lot of people are putting off care. What trends are you seeing overall in terms of cancer care from your institution?
Yeah, so COVID is a perfect example of, the whole country shut down basically for a period of time. And because of these COVID restrictions, there were many patients who were unable to or were fearful to undergo their routine screening. And so as a cancer physician, we kept working throughout the whole pandemic. We continue to take care of our patients, but there was a lag in terms of patients getting the appropriate screening on time based on all of these social issues that were taking place. And so anecdotally, as we've noticed in our practice, there was a bit of an upshift in the stage of disease. So you had talked about, if you find it early and you can treat it early, that's the optimal mechanism. But if it's delayed, the stage progresses, it's more advanced, and then the treatment is more difficult. The outcomes, the cure rates may not be as good. And so fortunately, in our practice, we have not seen a decline in outcomes. Our patients are doing well. But we did see, for that short period of time, there were more patients coming in with slightly more advanced disease. And you worry, because that's a nationwide occurrence that happened everywhere. There are papers that have been published looking at how COVID, this terrible pandemic, had affected individuals screening for cancer.
I'm sure that's magnified within the Latino community, particularly if you have people who have been reluctant to get care and continue to put it off because of the pandemic. Certainly, that's going to be a major issue, a healthcare issue, and continue to raise those numbers in terms of survival rates. Is there a difference between the screening process for men versus women? We saw the statistics that particularly Latino males were like at a higher rate of death, if you will, from colorectal cancer women were lesser rate, but still high. Is there a difference in the testing?
The testing is the same. The recommendations are the same. The incidence of colorectal cancer is the same. But there is a difference between the sexes. I think that men are particularly more reluctant. So if we look at the Latino community in general, if we already know there's a reluctance, this is magnified in the male population. Okay, women, they tend to, and I'm not making this up. This is for real. Women tend to get screened at higher rates than men do. Okay, so it just is what it is, and these will be magnified in the Latino population. And it's not just colorectal; it's breast cancer. It's every type of cancer that we see. We were talking about the COVID pandemic, and and you're talking about women in general. There was a specific case where we had at AtlantiCare a woman who was reluctant to have her screening for breast cancer, and ended up getting her screening because of a variety of reasons, found out she had breast cancer, and was able to be treated, and at this time is cancer-free. And so I want to encourage the women and the men in the Latino population to seek this out. Talk to your doctor about colorectal cancer. That's what we're talking about today, but all types of cancer screening, and get the appropriate screening. And especially the women should be looking out for their men too. So vice versa, we should be looking out for each other, making sure that we're getting the appropriate screening.
Yep, absolutely. And doctor, tell me about the locations for the Cancer Institute.
Yeah, so we're really pretty convenient, I believe. We have a center down in Cape May Courthouse that serves basically Cape May County and the surroundings. And we have another center in Egg Harbor Township. And both of these centers provide all of the types of cancer care that you might be looking for. We have medical oncology, radiation oncology, we have surgeons, we have a variety of screening programs. So I would encourage individuals who have a specific question to reach out and look into it further.
And we do have the AtlantiCare website, which we'll put up. It's atlanticare.org, where you could get more information. There's also the number for the Access Center, which is 1-888-569-1000. So certainly time to get, if you don't have a physician, time to make that appointment. And in addition to finding out whether or not you have cancer or not, screening still produces other important information for doctors to share with their patients, correct?
Absolutely. So we may not find cancer, but we may find another issue that can also be addressed at the time of the screening. So absolutely great point. While it's designed to look for the cancer, I can't tell you how many times we'll find something else and really improve that patient's quality of life.
Well, doctor, this is very useful information. Thank you for sharing this with our audience. And unfortunately, that's all the time we have. Thank you for coming on.
Thank you, Bert.
And thank you for joining us at home once again here on Latino Motion.
Choose to get your feet wet, to learn more about protecting our environment.
Choose to read minds, to understand the human brain.
Choose to get your hands dirty, to create a masterpiece.
Stockton University offers 50 high-quality academic programs, small class sizes, and affordable tuition. Choose to match your interests and talents at one of New Jersey's nationally ranked universities.
Funding for Latino Motion is provided by AtlantiCare, offering primary, specialty, and urgent care, plus surgery and more. Atlantic City Electric, energy for a changing world, and South Jersey Gas.